My name is Dr. Srikanth V. Jowls. Jowls basically refer to the excess loose skin around the cheek and the chin. This become more prominent as we age. As we age, there is a tendency to put on weight around the face, especially on the side of the face. So a triangular looking face tends to look more square, and this is caused by the jowls. This is due to accumulation of fat. It can be also due to poor habits and lifestyles like smoking, drinking, overeating, putting on obesity, too much of weight. These can lead to hanging jowls around the face. How is it fixed? It depends on what kind of jowls you have and how heavy your jowls are. If it is a mild to moderate jowl, then it can be fixed with a simple thing known as a thread lift. A thread lift is done under local anesthesia. However, you should know that this is temporary. In all the thread lifts last anywhere between 1.5 to 2 years, if you're lucky, up to 3 years. In a little more advanced case, you may be required to undergo a procedure called as a liposuction for the jowls, so that the excess fat which is deposited around your jawline is sucked out through liposuction, and you get a more firm and a well-defined jawline. In very severe cases, you may have to go in for a neck lift. A neck lift is a surgical procedure. It is done in the operation theatre. What is done is that the excess fat and skin is removed, the platysma is tightened, and you get a more well-defined neck. What is the difference between blleroplasty and tosis surgery? This is a common question that a lot of people ask. Now, blleroplasty is a condition wherein there are skin excess on the upper eyelid. So, it acts like a slight weight on the upper eyelid and makes the eyelid look droopy, tired, and also you don't have that fresh look throughout the day. Tosis, whereas, is a different condition. It is a weakness of the upper eyelid muscle. It causes the entire eyelid to sag down. There is no excess skin, but the eyelid falls below the limbbus, that is the border of the dark of the eye. It may be 1 millimeter, 2 millimeter, 3 millimeter. So, tosis is basically caused because of weakness of the eyelid muscles, whereas blleroplasty is a process of aging. This is the two major differences between tosis and blleroplasty. Both can be fixed with surgery. There are certain people in whom, as time goes by, there is an element of tosis which is added on to the baggy eyelids of the upper eyelid, and in such patients, then they require a correction of both the blleroplasty as well as the tosis, that is the muscle tightening. Whereas in a separate segment of patients, only blleroplasty will solve the problem. If it is tosis, the surgery is entirely different. There are different kind of procedures which are used to correct the tosis depending on the degree of tosis, depending on the kind of muscle that you have had, and also it also depends on whether you had any kind of previous surgery. Both can be done by a plastic surgeon. I suggest that you get yourself evaluated and then go ahead with the correct surgery. Wide nose and rhinoplasty. Now, this is a very common subject, especially in the place that I practice, that is in the south of India. A lot of people have wide noses, broad noses. This is the way our body habitus is structured. The treatment for a wide nose depends on the cause of the wide nose. There are different causes. One is broad bones. Second is big, wide alar cartilages. Third thing is widened upper lateral cartilages. Fourth thing is a widened nostril. In some people, you may also have very thick sebaceous skin which give rise to a wide appearance of the nose. The treatment for this is rhinoplasty. Multiple procedures needs to be done. If it is a wide bone, the bone needs to be shortened. If it is big cartilages, the cartilages need to be narrowed. If it is wide nostrils, the nostrils needs to be narrowed down. And in some cases with thick skin, with all this, to get a good result, your plastic surgeon may advise you to undergo cartilage grafts, because these cartilage grafts are what reshape the nose and they give a prominent look to the nose. So, in certain cases of wide noses, you may need to use cartilage grafts. The source of the graft will be either from your nose, it can be from your chest wall, it can be from behind the ear. There are different sources of cartilage. So, for the overall treatment of your nose, you should be willing to undergo all these procedures so that your nose looks nice, fine and narrow. In certain cases, the plastic surgeon may suggest to take certain injections to thin down the thickened skin called as steroid injections to flatten the skin in case you've got very thick skin. All these small procedures done will give you a narrow, sharp looking nose. What is reconstructive burn surgery? Now, every plastic surgeon who is trained in India will know what is reconstructive burn surgery. Basically, burns is a very devastating disease. The skin is burnt off and the wound heals with scars. And these scars can cause excessive deformities depending on which part of the body is burnt, whether it is the head, whether it is the neck, whether it is the shoulders, hands, thighs, feet, abdomen. Wherever the part is burnt and healed with scars, these scars causes deformity. Now, reconstructive surgery helps to reverse these deformities. For example, if there is a bad scar on the face, you can resurface it with a skin graft. If there is contractures of the hand can be released. Similarly, if there is contracture of the elbow, axilla, neck, knee, these can be released and they can be resurfaced with a skin graft. In certain cases, more specialized treatments are there. That is the use of tissue expanders. There are silicone balloons and these are used to resurface the burnt areas. Even more advanced things are there, like using artificial dermis, which helps to give more pliable skin so that the stigma of burns is reduced to the bare minimum. If you have had problems with burns, I suggest that you go meet your plastic surgeon and he will tell you whether these scars can be improved with reconstructive surgery.